Also on our podium discussion is our President and CEO, Petra Bruckmüller. She's going to introduce the topic. And then we have a special guest, Luca Vigo. For those of you who don't know Luca, he is an ophthalmologist and co-founder and partner of the Carones Vision eye clinic in Milan, and also the director of the Dry Eye Center of Carones Vision. Before we start, some general points. The webinar is going to take 1 hour. And afterwards, we are collecting some questions after the presentations. The presentation itself will take about 20 minutes, 20 to 30 minutes. And afterwards, we will have a Q&A session. So feel free to ask as many questions as you can. And I will then distribute the questions via the Q&A function to either Luca or Petra. I hope for a lively discussion. And I would hand over to Petra for the introduction.
Thank you. Good morning to everybody in the webinar. It's our great pleasure to start our first public webinar series with the participation of Dr. Luca Vigo. I think we are connected with a long time journey already in dry eye management. Luca Vigo was, but he will introduce by himself, for us a very important dry eye specialist since the beginning. And we invited him to join our webinar series, especially now after Corona, because this year, 2010-20, will change many aspects in our market, in our usual business, in our business activities. As many of you know, most of the congresses are cancelled this year. And so we are very pleased to start, especially with Luca Vigo, our dry eye webinar series with different topics through the next months to guide you through the year, hopefully with every time with new interesting topics, but most important with the opportunity to exchange with key known and key leading dry eye specialists worldwide. And so we're very excited that this webinar are joined by many participants nearly from worldwide, especially if it's early in the morning. I would immediately give the word to Luca, not to lose time on his interesting topic. And he will let you know about his experience in dry eye, but I think especially also how he handled to come back to a bit normal, especially in Italy, after this very severe pandemic situation. Thank you, Luca, and yeah.
Thank you, Petra. Thank you, everybody. And I want to introduce myself. Like Petra told you, I'm an ophthalmologist. I live and work in Milano. And I'm interested in this particular field of ophthalmology, in the dry eye, since probably 2016. I was the first user in Italy of EI. And so I brought in Italy this particular device. And since the beginning, I was very happy in using this device because I had very important result in treating dry eye disease. So this is the reason why I'm here today. And this is the reason why I know very well Petra since 2016. Anyway, let's start with this interesting topic that is how to drive EI business after coronavirus. Yes, this is an important and a very difficult period, I think, for everybody. If you want, you can also present, if you want, you can also show my presentation. I have few slides to show you. It's up to you, or you want to share the video with the audience.
You can share the video.
I can share the video. Okay, so I share my screen. No, I'm disabled to do that, probably because yeah, you can do, or you can let me do this. I'm not allowed. Okay. No. Yes. Okay. It's okay. Here is. Okay. Let me see if it works. Yes, it is. So I think that this is a very bad period because probably you know that in this period we had to remain at home, and we had to stress our visual acuity because we had to do many things that usually we do not so much every day. But I want to do a little introduction about what is the meibomian gland dysfunction and why is it so important. So, first of all, I want to remind you that meibomian gland dysfunction is the leading cause of dry eye disease through the world. So this is the beginning. So we know that the majority of patients suffers from dry eye disease because they have a meibomian gland dysfunction. This means that this kind of dry eye is because there is an excessive evaporation. And I think this is very important just to start with this topic, with this issue, because during the period that we have, that we lived during these months, this situation increased a lot. And we will see why in a few minutes. And we know also that this particular disease is growing, and we expect that in few years, probably almost 40% of the population will suffer from dry eye disease for excessive evaporation, because 86% of all people that are suffering from dry eye disease are suffering from evaporative dry eye disease. And so now we arrive at this moment. We arrive at this moment, and we arrive to this particular period of lockdown, and these are the driving factors, and we will see each of them one by one in order to see why these factors are a driving factor to increase, to improve the risk of having dry eye disease, and the fact that we can use different solutions. And in case of EI, of course, we can use EI just to prevent and to treat dry eye disease. What is lockdown? Lockdown, unfortunately, was I think the worst period that I have never lived in my life, because you can see these three beautiful cities in Italy, Milan, Rome, and Venice, and you see that nobody was allowed to go to work, to go out, to exit from their apartments, their houses. And this was a very long period. We had to remain at home. And what do we can do remaining at home? We can we use PCs, we use monitors, we use TV, we use tablets. Many people had to stay at home to do what we call smart working. And I think that all these devices, and with this particular condition, our visual acuity was really stressed. And you can see in these images, sometimes after 1 hour, 2 hours, 3 hours, we had some a little bit, we were tired, we had to close our eyes. And why this? This because when we have to stay many hours in front of a monitor, we tend to have an evaporation of dry eye, and we stress also the accommodation. And so this leads to the particular symptoms of dry eye disease. This is a particular image showing the evaporation on the sea. But we had this excessive evaporation because when we are looking at the monitor, we tend to keep our eyes open for a longer period than usually we do in a routine basis. And so this is the reason why our tear films tends to break up and to evaporate very soon. And so now, so this is the reason why patients were complaining, and they came into our offices saying that they had some burning symptoms, itching and redness in their eyes, and so they were complaining a lot. And this is the reason that the reason were correlated to this particular period, in particular, who smart working or using of monitors. But at the same time, people were not allowed to go to the standard, to the official hospitals or institutes where they could have any kind of treatments, because you could not go to the hospital, because hospitals were all related, all for COVID patients, so for coronavirus patients, and also the patients were afraid to go to the hospital, and because the risk of getting the infection. And so the patient had symptoms, but on the other way, they could not have a particular therapies in hospital, because hospitals were completely congested and full of COVID-19 patients, and also because there was a higher risk to get infection going to this kind of hospitals. So this is the reason why the majority of patients decided also in this period, and also now after the lockdown, to come to a private practice. In this case is our private practice in Milan. You can see brand new, because we finished this clinic a few months ago, and unfortunately a few months ago we finished the clinic, and immediately after we had the lockdown, and we had the coronavirus, so we had to stop everything. And now after the lockdown in May, we start again in having our practice. And this is our practice. You can see it's completely, of course, different from a hospital. This is a private clinic, of course. And so I found that in this particular situation was much more easy for me to suggest, in this case, IRPL treatment, a particular treatment to solve, to improve patient symptoms. And these patients were much more compliant, had much more compliance than in other periods, because we were probably the ones that could offer particular conditions of security, with no particular risks of getting the infection. And so I think that particularly in these cases was very important to provide safety protocols for patients and staff in our clinic, using shields, for instance, for devices that we have been using, for slit lamp. We provide disinfection for all the patients that come in our clinic. And in this particular situation also, we provide an accurate patient evaluation. You know that one of the fears of our patients was to get also the viral conjunctivitis that is correlated to the coronavirus. And especially in these cases, patients came into our practice, into our clinic, they were very afraid of having this kind of disease. I mean, the viral conjunctivitis associated to coronavirus, and not only a dry eye symptoms or dry eye signs related to the eye. And so it was very, very important to screen this kind of patient and let them know that this particular inflammation was not related to the virus, but was related to dry eye symptoms. And especially in this case, I think that is very useful to suggest and to prescribe to our patient, to our dry eye patient that had an increase in their patient symptoms because of the reason that I showed to you earlier, to provide, to suggest a complete package offer. I mean, I want to visit the patient, I suggest a particular treatment, in this case IRPL, so intense pulse light. I also tell them that I want to control patient, and this to reassure patient and to improve their confidence. And I do this because I want that the patient are confident, of course, of what I'm doing and of their situation that is not correlated to coronavirus, and there is no particular risk in this situation to get this infection. Because I think that another possibility that the patient are asking you is if this particular situation, I mean of dry eye, of near vision stress that they have during the smart working or using tablets or smartphone for many hours in a day, the risk to get the virus much more easily going outside and to go to the market or to other places. And this is another answer that I usually do to my patient, saying no, there is no particular higher risk to get this infection if they have this particular ocular inflammation. But anyway, in this particular situation, I want to provide for them a specific therapy to decrease the patient's symptoms. So I think that now I can conclude this particular presentation, this little presentation, showing also my what I call dry eye spa. Dry eye spa is our room, all dedicated. That is all dedicated to the dry eye patients. You can see the bed. You can see more devices that I can use to treat my patient. And there are the devices. There is this little lamp where I can squeeze the glands. I can check the eyes of my patient. And this is what I usually do. And I have to tell you that now, in the particular period, I saw an increase in this particular kind of patients. But anyway, for me, it was much more easier to treat this patient because patients are much more confident with me and in what I can offer them. So now I can stop my very, very short presentation, and I'm here just to answer your questions. I recommend to do again the entire protocol.
Okay, perfect.
Then you just have a look
left. Yeah, exactly, because we know Luca has to go to the operation theater later, right?
Yeah, unfortunately, yes. I start at 9:15, but now I have time for other minutes, no problem.
Yeah.
Okay. We are still going to continue to collect questions, and if there are questions that are not going to be answered now, then we will provide the answers after the webinar. I also want to remind you at this point that we have 3 other webinars upcoming the following weeks. Next week, there is a dry eye diagnostic webinar where also Dr. Luca Vigo will be joining us. There are 2 time slots, one at 8 a.m. in the morning and one at 4 p.m. in the afternoon. In 2 weeks' time, on the 23rd, we have a best practice EI treatment where Dr. Jennifer Craig will be joining us, and in the evening, Eric Robertstadt. And in 3 weeks, on the 30th of June, we will have a discussion about the future of dry eye management. I think we have time for 1 or 2 more questions. Maybe Luca, can you describe how do you work with EI in a precautionary way, in a prophylactic way for your surgery patients and for LASIK patients?
Yes, good question, because yes, another way that we can use EI is also to prevent dry eye. And I do this especially when I have to do surgeries to operate a particular patient cataract with premium IOL or refractive patients with LASIK, for instance, because if I see that the patient, because I want to check all my patients regarding the tear film before doing any kind of surgery. So if I find that there's something wrong with the tear film, and I check also the osmolality. Osmolality is another, I think, important value that we have to check when we screen dry eye patient. If the patient has, for instance, hyperosmolarity, I prefer to treat these kind of patients before doing surgeries. And in this case, I use EI just to reduce osmolarity, to improve the tear film production, and then I do surgery. Because I think that if you treat patients that have beautiful tear film and a good tear film before doing surgeries, the results are better than in case of patient with better tear film or hyperosmolarity.
Thank you. Also another question, which equipment do you use or recommend to assess dry eyes?
Which kind of equipment?
Yeah, do you use for analyzing dry eye?
For analyzing dry eye. Yes. For analyzing dry eye, I think that now you know that I'm using also the tear check. Tear check is not available now on the market, but will be very soon. And this is a very, very good instrument. I have other instruments. I have the CSO instrument. I have the DPView. I have other instruments in my clinic. But anyway, I think that there are good instruments that are available now on the market that you can use and that can provide that you can get all the data that I told you earlier. We will talk about the diagnostic probably in the next webinar next week, and so I go deeper in this kind of examinations. But anyway, I hope that you will be able to use the tear check very soon. Now I have good results, and I'll tell you about these results in the next webinar.
Yeah. Just to give you this information, you're right. Through Corona, we were obliged also to keep the first production series in stock, but we started now with shipments this week, and we are very happy. First tear checks already left, and hopefully very soon, everywhere in the world, tear check will be also in use.
Good. Good.
Then I would like to thank everyone for participating, especially you, Luca, for taking the time to share your experience and your knowledge with us. I think Petra and I are going to stay a little bit longer in the webinar, so you can all submit some more questions. And we will then coordinate with Luca to get all the questions answered and to provide them to all the participants.
Good. Very good. So thank you very much, and have a good day. Okay. Bye-bye.
And enjoy your day. See you next week.
See you next. Bye-bye.
Yeah.
I have here again our upcoming webinars. As you can see, the next webinars are all available in 2 time slots, one in the morning and one in the afternoon, so that really everyone around the world can participate at an hour that's not in the middle of the night.
Yeah, we invited also Professor Jennifer Gregg to join our webinars. She was the initial first, I would say she set up the initial first clinical study of IRPL treatment 5 years ago. She will use this webinar also to share with you more details in behind from her second study, which she published now in February, which comes with very exciting results also to dry eye treatment. And as Dr. Luca Vigo already mentioned, he and also Eric Robertstadt, they are experienced since beginning of the year, means before Corona period, to use our tear check diagnostic device to analyze tear film stability. They have very exciting feedbacks here they collected, and they will share with us, with you in the next webinars also their experience. And last but not least, the future of dry eye management is definitely something in times like that, especially in this year 2020, something very interesting. We would have sponsored also the TIFOS conference in September in Italy, which is unfortunately also annulated at this time, where the TIFOS conference always is a platform where Jennifer Gregg is also speaker, Luca Vigo would have joined. It's a platform to discuss what will be the future, what are the new updates on the therapies, on different types of therapies, how to diagnose, how is the disease, which became the second most common eye disease worldwide, how is it really treated? So we will use this final webinar in June to discuss here. It will be more or less a discussion webinar to regard also different impacts from all over the world. And in time during June, we will also announce the next webinars upcoming in July and August to keep you updated, of course, of all new feedbacks, new experiences, and best practice examples, which we really receive by great pleasure from everywhere in the world, and which is also for us as a manufacturer interesting to share with you, interested in dry eye management, and based on the experience of all the specialists. In the meantime, more than 1,500 EI users use our treatment technology to manage dry eye. And it will be interesting in next months to see more and more upcoming users also from the diagnostic tool. So yes, thank you from our side also for joining this first public webinar. Daniel from our team will take care to, as explained, to answer open questions or to complete open questions. Anyway, he will follow up also to give you our contact details. You can contact us anytime, our team, to answer or to give more details on our products and our dry eye management concepts. Thank you for joining us.